Depending on your OT education and fieldwork experience, you may have been exposed to certain psychosocial concepts and terminology or not. This video will review commonly used concepts and terms for psychiatric illnesses and cognitive disorders for the NBCOT exam. After watching this video, especially if you're only watching this on YouTube, be sure to enroll in the free NBCOT exam prep course to quiz your knowledge with the matching game. Link will be in the description. I'm Jeff, the OT dude, and let's get functional. One way to organize or categorize these terms is based on the categories of cognition, speech, and behavior. Let's start with the simple and obvious ones. Speech is, well, speech, and the different kinds of speech that fall under it, from slow to fast, to quiet, to loud, to pressured. Motor behaviors are observable behaviors that are either intentional or unintentional. The next broader category has to do with cognition. So first, you have to have consciousness, think Glasgow-Coma scale or Rancho levels. Then you have attention, like to pay attention to the environment or to the activity. You may also have some thoughts too, right? And oftentimes emotions associated with it. This is very similar to the CBT model, how you have thoughts which influence feelings, which then influence behaviors. And in this case, motor behaviors. And then last is one's perception of themselves and the world around them. Now let's review specific terms that fall under each category. Keep in mind that this video is a general review and we won't be doing a deep dive into the conditions, other symptoms, and OT interventions. That'll be for a future video. So with speech, global aphasia is the ability to understand and express language. I often see aphasia with patients who have had a stroke, for example. You can imagine how this would affect one's psychological, psychosocial outlook, not being able to communicate with others around you by understanding them or expressing yourself, or even your internal thoughts even not working the way that they have always been, can be very stressful. Aphasia is divided into expressive and receptive. Broca's aphasia for expressive and Wernicke's for receptive aphasia. You can remember Broca's for expressive as Broca kind of sounds like boca. That means mouth. And we use our mouth to speak. Therefore, process of elimination, Wernicke's aphasia is for receptive aphasia. Broca's aphasia is also called non-fluent aphasia, as you are unable to speak and therefore are non-fluent. That would mean that fluent aphasia is also known as Wernicke's aphasia. A third type of aphasia is called anomic aphasia. A meaning without, nomic meaning naming things. So anomic aphasia is the inability to use words to name things that you want to say, such as with nouns or with verbs. Speech language pathology also likes to call this difficulty with word finding, or commonly referred to as on the tip of my tongue, for example. Perseveration, or when one is perseverative, is kind of like when they are stuck on saying certain things, such as phrases or words, repeatedly. Are we there yet? Are we there yet? Are we close? Perseveration is also used for perseverative thoughts, such as someone who is depressed may be constantly having negative thoughts about something, such as suicide ideation. Pressured speech is fast and rapid speech. An example of pressured speech is, gotta study for the MUCTM, it's got no time, flashcards, this study guide, everything, watch videos, kind of like that. The opposite is called poverty of speech. Here's an example of poverty of speech. Poverty of speech may be associated with schizophrenia, but also other mental health conditions, even anxiety. Alogia is similar to poverty of speech and is the general lack of normal speech. Another similar term is laconic speech. You can remember this because it sounds like lacking in speech for laconic speech. Stonewalling is when someone intentionally refuses to communicate, say speak, such as when like a couple is in like an argument and one partner is refusing to speak. So it can also be a defense strategy. Poverty of content. This is an interesting one. It's basically when you talk to someone and you find out that they're not really saying anything meaningful after like a 5-minute conversation with them or something. So they talk, but they don't say anything substantive. You understand what they are saying, so there is no issue there. Like they make sense, but it does not convey any meaningful information. It's often associated with conditions such as schizophrenia, intellectual disabilities, developmental delays, and even severe anxiety. Hyperverbose, as you can guess from the word makeup, is speaking a lot, like constantly talking, someone who is a talker. Non-spontaneous speech, kind of the opposite, is when a client only responds when spoken to. They are therefore non-spontaneous. Selective mutism, and also an interesting one, think keyword mute, causes people who are otherwise able to speak normally, but they stop speaking in some situations, such as a stressful one or in a social situation. So a good example of this is in Big Bang Theory. Raj experiences selective mutism when he is with the character Penny and he is expected to speak up. He just goes mute. Disorganized speech. Does this mean that someone is messy in their speech, like a messy room? Well, disorganized speech makes someone difficult to comprehend, and it's a broader term, like an umbrella term. Disorganized is also another symptom of schizophrenia, actually. We talked about pressured speech earlier, right? When someone speaks really fast, they may also become incoherent. So it's also another form of disorganized speech. And you know how parrots like to repeat and copy the words you say? Like cracker, 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 cracker. That's also called echolalia. It's a sign of speech delay in children, Tourette syndrome, and also Alzheimer's disease in adults. Echolalia may also occur with schizophrenia as well. Sometimes clients love to make up new words, and that's called neologisms. An example is the word spork, which basically is a which is basically a spoon and a fork, so we call it a spork. And I've been eating a lot of salads lately with a lot of random things put together into this one salad that's supposed to be healthy for me. So word salad can be thought of as jumbled speech that is also incoherent because random words or phrases are put together and it is one kind of disorganized speech. An example of word salad is iPhone, NBCOT, Chick-fil-A, photos, slippers, shoes, telephone, sky, loving, tired, and cool, and socks. It's actually really hard to make up a word salad phrase because you think so coherently, and to be so disorganized, it's just really, really challenging. You should really try it. It's kind of fun, actually. Now let's review motor behaviors. One you're probably already familiar with is ataxia, for abnormal movements due to the difficulty with irregular muscle coordination. Akathisia is a common side effect of medications that results in restlessness. A sibling of akathisia is tardive dyskinesia. It kind of rhymes, and it's also due to side effects of neuroleptic drugs. While akathisia is characterized by constant motion, such as the inability to sit still, tardive dyskinesia, TD, is characterized by repetitive, purposeless movements that involve certain areas, such as the mouth or the limbs. It isn't always easy to differentiate, and according to one research article, clinicians are not always able to distinguish between akathisia and TD. The opposite, lack of movement, may be described as catatonia, which is immobility or rigidity. Remember the term echolalia for copying someone's speech? Echopraxia, key phrase or word, praxia is the same thing, but for copying someone else's movements. Now, it gets a little bit confusing, but there's also stereotypy, which is repetitive or ritualistic movements or postures, such as rocking, self-caressing, or marching in place. This is more associated with conditions such as autism or intellectual disabilities, but also possible too with conditions such as schizophrenia and frontotemporal dementia. It's important to distinguish stereotypy from tics. Compared to tics, stereotypies involve more parts of the body and are more rhythmic. Tics are more random and may be more suppressible, whereas stereotypies may be more difficult to suppress. I think of the character Data from Star Trek that featured his clone who had a tic. Another term that is also similar is psychomotor agitation, which basically describes what that phrase means. I really wouldn't worry about distinguishing too much and differentiating between these terms. Just understanding what they mean in general is probably good enough for the NBCOT exam. On the extreme end of the spectrum is hyperactivity, right? The opposite would be hypoactivity. Hypoactivity is similar to catatonia. So to paint a picture, in the hospital where I work, we get a lot of code grays being called, basically someone who is acting out or being aggressive or overly aggressive towards staff. So hyperactivity. Keep in mind that this is not always due to aggressive behavior, such as being angry, but it can be fear-based or due to confusion like fight or flight, or with patients with dementia, for example, can maybe wake up or are sundowning and they find out they may be stuck in the hospital or held hostage in the hospital. So if you're finding this video helpful so far, please give it a thumbs up right now so you can help other students like yourself find my videos easier. I would also appreciate it if you also shared this with your friends and study groups. You can also support this channel and my content in other ways, becoming a Patreon member, tipping me in the tip jar, getting some cool OTDUDE designed stickers, t-shirts, or my very own handmade badge reels to wear as a student or at work. These make great gifts too. Links will be in the description. Now back to our content. When thinking about consciousness, such as the presentation or the response of patients from the Glasgow Coma Scale, we need to have consciousness to interact with the world, right? So a term you should definitely know is orientation. Whether someone is oriented or disoriented is described by the A and O term for alert and oriented, such as alert and oriented times 3 or times 4. Orientation questions are someone's awareness to their name, place they are currently at, the time, such as time of day or the day of the week or even just a year, and the event, basically what is happening currently or what happened to them, such as them getting into a car accident. And one thing to differentiate is that someone who is disoriented is not necessarily the same as them being confused. Confused or confusion is an inappropriate perception and response to environmental stimuli. However, these two may have overlap and can occur together, as someone who is disoriented often presents with confusion because, well, they don't know where they are or what day it is or what day of the week it is, for example. But usually the last to go is someone's awareness of their own name. Like if you forgot your own name, then you probably had a pretty major thing happen to you, such as a stroke or a major car accident. And usually when you ask someone's name, they often know it. But again, to differentiate orientation from confusion, orientation is basically being able to answer those alert and oriented questions. So if A and O times 1, times 2, times 3, times 4, such as times 4, meaning you are alert and oriented to all those questions. So say A and O times 1 only, you could probably guess that they're alert and oriented to their name. But confusion is basically confusion around their environment. And then the extreme end of the spectrum towards this kind of condition is unconsciousness. There is also coma or comatose. Coma is defined as a prolonged state of unconsciousness. An example is someone who blacks out from, say, alcohol. They're not necessarily in a coma, but they may be unconscious. But if they are prolonged, then it would be in a coma. Delirium, or someone who is delirious, is defined as a disturbance in mental abilities that results in confused thinking that also has reduced awareness of the environment. The difference between confusion and delirium is that confusion is a milder form of delirium. Psychosis is characterized by someone who is disconnected from reality. It is associated with conditions such as schizophrenia, but also epilepsy, Alzheimer's, and bipolar disorder. Symptoms associated with a psychotic episode include extreme emotions, incoherent speech, delusions, hallucinations, withdrawal from the environment, depression, and suicide ideation. Psychosis is often associated with schizophrenia, but what distinguishes psychosis and schizophrenia is that psychosis is a common symptom of schizophrenia, but psychosis can also be from other conditions. And to paint a picture, an example of psychosis is the character Joker from Batman or the movie Black Swan. A term often associated with dementia that I mentioned earlier is sundowning. How long has that water bottle been there? It's probably been named after the time of day in the afternoon when the sun goes down and there is an increased state of confusion that goes well into the nighttime. Sundowning may be characterized by confusion, anxiety, and even aggression. Now let's review the terms that are based on one's attention. Are you paying attention, or are you distracted or easily distractible? Distractibility is one's inability to concentrate or to sustain their attention. The lack of attention is also known as inattention. Inattention in OT is used in two ways, actually. It's the lack of attention, like we just described, but also pertaining to a visual perceptual deficit, such as after a stroke, someone may have inattention or even neglect. So we all choose what we want to focus on in our very busy world around us, right? So in mental health, selective inattention may be a defense mechanism that involves ignoring or blocking out the stimuli based on what we find is interesting or important. Trance is similar to this, and when someone is in a trance, they are in a state of minimal awareness to the environment. They are often in like a sleep-like state. Hypnosis is a guided form of relaxation that involves someone being in a state of trance. And no, I'm not talking about the radio show. In some psychotherapies, they use hypnosis as an aid to allow clients to explore their thoughts, feelings, and memories that may be hidden or suppressed from their consciousness. Another term is stupor, which is a state of decreased cognitive functioning or awareness. However, the person is still conscious though. So with stupor, they are often confused and may have catatonia. Someone who has stupor may also appear sleepy and appear rigid and in a decreased state of consciousness for their environment. Think sleepy stupor when you think of the term stupor. The opposite extreme of this is hypervigilance, which involves someone having increased or excessive attention, usually due to suspicions with schizophrenia or even generalized anxiety. You may have heard of hyperarousal. This is similar to and associated with symptoms of PTSD. And I'll try to kind of embody this as I describe it, such as due to anxiety or paranoia, and is also known as dysphoric hyperarousal. Anergia is characterized by ongoing lack of energy from normal daily activities. It may be associated with depression, substance abuse, or maybe medically caused, such as having a sleeping disorder. Now let's talk about our feelings or our emotions. Euphoria is characterized by an elated, high energy state with grandiose feelings and ideas. I'll try to do this because this is definitely not my personality. What about mania? Clients with mania exhibit extreme excitement and euphoria. They are hyperactive and may have hallucinations or delusions. Some people with mania are just jumpy and extremely anxious though. We talked about euphoria. Dysphoria, D-Y-S-P-H-O-R, I'm not even gonna try and spell it, is a state of unease or dissatisfaction. Dis, like dissatisfied. Dysphoria is the opposite of euphoria. Dysphoria may accompany depression, anxiety, or agitation. Affect is someone's outwardly, this is a tongue twister. Affect is someone's outwardly display of their emotional state. On the low end, there are actually 4 types of reduced affects. Someone may have a flat affect, which is the lack or absence of emotion. Blunted affect is one step above flat affect, where flat is none, blunted is some. Blunted affect is actually very similar to anhedonia. Anhedonia is one's lack of pleasure with activities, right? Other similar terms are constricted affect, restricted affect, and shallow affect. Don't worry about differentiating them either. Just be familiar that they're similar terms. Conditions associated with these types of lower or flatter affects or blunted affects include schizophrenia and PTSD. Dysthymia is a persistent depressive episode in the DSM for depression. Now let's talk about appropriate and inappropriate. This is used in two ways. One is basically in terms of how someone may behave, such as them being sexually inappropriate with staff. In an emotional context, appropriate and inappropriate are defined as consistent or inconsistent based on the situation. Like someone who is laughing at a funeral or something would be inappropriate affect. This is also known as incongruent as well. Labile or lability is when someone who changes their emotions, such as someone who's crying 1 minute and then laughing the next. So they're very labile. It may be due to a psychological or mental health issue, but is often confused with pseudobulbar affect, PBA, and that's known as emotional incontinence. This is more due to the brain damage in an area of the brain that regulates emotion, causing someone to basically cry or laugh uncontrollably, and they have no control over it typically. I also have a video on PBA if you're interested in checking that out on my channel. Expansive affect is often associated with bipolar disorder and is characterized by extreme or elevated moods. It's more of a state of mood than an emotion, but whatever. Another cool term is transference. It's when someone else's emotions are transferred onto another, such as a therapist and their client and between them. Two more categories to cover are perception and thoughts, and they're pretty straightforward too. I think perceptions are fascinating, so I'll talk about these first. One thing to differentiate is between perception and perceptual disorders. Perceptual disorders are characterized by the cognitive inability to perceive the environment, often due to sensory impairments, or it could be mental and in your head. You already know some of these terms, such as hallucination and delusion. Another term is illusion. Agnosia is the inability to interpret sensory input or stimuli from the environment. An example is visual agnosia for the inability to recognize people. Nosonosia is characterized by one's inability to recognize that they may have a mental health condition, or could be thought of one's lack of insight or denial into their own state of mental health. It's often associated with conditions such as schizophrenia, bipolar disorder, but it can also be from trauma, stroke, or even dementia. You probably learned about stereognosis, basically the ability to feel objects and tell what they are without looking at them. Astereognosis is the inability to identify things through touch. Now here's a fun one. A word that I like to use in documentation when I feel fancy is basically dysdiadochokinesia or adiadochokinesia. Dysdiadochokinesia is basically someone who has difficulty with rapid arm movements, and adiadochokinesia is someone who basically can't even do it. Let's talk about the D's now. Depersonalization, derealization, and dissociation. Depersonalization, keyword personal, involves detachment from oneself and the perception that you are unreal or inanimate. Derealization is similar, but instead of person, it's the perception that the environment is not real. I think of it like kind of like a video game or something. Dissociation, or being dissociated, is characterized by separation from the rest of yourself. Not physically, but basically mentally. Kind of like when you daydream, for example. Someone may be dissociated from their thoughts, their feelings, memories, and environment, or even sense of time. Dissociated fugue, or a fugue state, is characterized by one's loss of identity or other important autobiographical information, similar to amnesia. An example of dissociative fugue is someone finding themselves, say, on the beach and not remembering traveling there. It's referred to in the DSM as bewildered wandering as well. It's often associated with a traumatic event, stress, alcohol abuse, depression, and child abuse. Okay, we're almost done here, so don't click away. Now let's review the terms for thinking or for thoughts. You already know terms such as obsession and compulsion, such as for OCD. You also know delusion, which is a false sense of belief in something. When someone speaks abnormally, they may be having some issues with their thoughts. Circumstantial thought is when someone includes a lot of unnecessary information in their conversation or with their writing. It's very similar to a term that we went over earlier, poverty of content. Someone may also be tangential or going on a tangent, characterized by loosely associated topics of conversation or in one's writing, or these days with typing. The opposite of this is perseveration, right? So sticking too much to one single thought. Another similar term is concrete thinking. Keyword concrete, think of it like the material. Someone who has concrete thinking lacks abstract thinking, and they think in literal sense, basically based on the environment around them, instead of abstractly, like when you need to do, say, things in 3D, for example. And so they may lack sometimes imagination. A condition associated with concrete thinking is with autism, spectrum disorders. To remember circumstantiality and tangentiality, think about math in those similar terms, circumference and tangent, which basically it go off to the outside of the circle. So it's similar to that. Or you can think of, in true crime terminology, circumstantial evidence. You can remember perseveration like the word preserve, like a can of jam or something, or if you buy it from the store with lots of preservatives. Okay, flight of ideas is pretty self-explanatory. It involves rapid changes in shifts or with thoughts. And in our today's busy lives, we probably have some aspect of this anyways. Like our thoughts don't really focus on one thing and smoothly on another. We kind of have quick shifts between different things. Like, okay, I gotta go to the gym. I gotta go buy something to eat. I gotta do my homework. Gotta pay my bills. Did I walk my dog? Did I reply to that text? But in a normal sense, with flight of ideas, it may be more abnormal and impaired for normal functioning. And flight of ideas is similar to the term loose associations. A person exhibiting loose associations will jump from one idea to another. Magical thinking is the belief or thoughts that someone can influence their environment, like with magic or something, like, I don't know, Harry Potter. An example is a child believing in Santa Claus, for example. Magical thinking is not necessarily a mental illness, but people with, say, OCD, delusional disorders, schizophrenia, often engage in magical thinking, and children often do as well. A similar term is confabulation. Due to a memory disturbance, someone who confabulates will basically misremember something. Confabulation is often associated with conditions such as schizophrenia, PTSD, and depression. It was once also referred to as false memory syndrome. So to quiz your knowledge, check out the NBCOT exam prep course in the description and quiz yourself on the knowledge of this topic. You can do that right now.